Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Well, welcome back to Insurance Matchmaking. Been kind of a crazy week going on. One of the things I've been doing a lot of lately is working with veterans like myself. I've got a good referral source for those people who come to me and been able to help them with the Medicare Advantage plans. And a lot of the agents that I work with or talk with in my Facebook group, things like that, they're a little nervous about working with veterans who have TRICARE in what becomes TRICARE for life when you go on Medicare. So if you're on TRICARE, even if you're not turning 65 this year, or you might, but if you're in your 60s, reach out to me. I can explain what's going on with those plans now and kind of help guide you towards that time when you do turn 65. But what it is, TRICARE is our main insurance right now, but when we turn 65 and we go on Medicare, Medicare becomes the primary insurance. And, of course, as you've heard me say on this show several times, if you listen regularly, that Medicare doesn't cover routine dental, vision, or hearing, and that's where those Medicare Advantage plans can come in. They also, most of the ones that are geared for those that have some type of veteran benefit, have that Part B give back. So they help cushion that cost of that currently $185. It's going to be more next year. We never know until, it's kind of funny, it's usually about either the end of October, early November, we know what the Part B premium will be next year. It's kind of like, we kind of need that when we're talking to people during the annual enrollment period, but the government waits to give us those numbers. So, the other thing I get a kick out of is, we get all our sales brochures, the sales kits, the books with the summary of benefits for each of the Medicare plans, and in those they'll have a page that is the star ratings. And then sometime in the middle of October, or first week in November, we get the updated, and we're supposed to put those now in those enrollment books because now that's what the current star ratings are. Why the government can't figure out the cycle of, hey, let's evaluate the star ratings and give that to the insurance companies to put in their sales material. They're printing in August and September so we can have it on October 1st. And then the other thing is that the Medicare costs, the Part B premium, the deductible, all those little things like that they do every year, those numbers, we should be able to have those numbers prior to the enrollment season. It's just a matter of them changing their cycle a little bit or adjusting their cycle so they can have that data a little sooner. So one of the things I want to, again, ask my listeners to help with, I know most of the people that are hearing me are probably hearing me on the radio and not going and listening to the YouTube recordings of my previous shows. We get those out as soon as we can. Just asking your help that maybe you are just listening on the radio. You may be listening while you're driving right now. You might be listening through the app when the show airs and at 10 a.m. on Saturdays. Do me, if you can, do me a favor, and you can go to insurancematchmaking.com, and all the previous shows are there. They're just links that you can click on the YouTubes. But I ask you to, go ahead and, like the video, subscribe to my channel, maybe share a video if there's something on there that's struck you that you think, hey, somebody else should hear this too. Share that on your social media. Help me get the word out. That's how I build my business. But I also not just build my business, but help people get those answers they're looking for. And that's another way to let people know that, hey, there's somebody local that will help you with your Medicare and your other health insurance needs and life insurance also. So I'm just really trying to get that going a little bit more. Not that I'm trying to be, a major YouTuber and be earning off my YouTube. It would be nice, but I'm not really expecting that. But just to get a little bit more exposure, and I know it grows. I know there's people who listen to my show. I've had interactions with people now, and then people I know go, oh, hey, I heard you on the radio Saturday. So I know people are hearing me, but it would really help me. And the other thing is, if you're on Facebook, please go and like my Facebook page. It's Matt Libby Insurance. You can search it. I'm in Hip Cookville, so I post on there every once in a while. But the word of mouth really helps, and that's what I was saying, talking about a lot of the business I've done just in the last couple weeks has been by referral, but it's about 50-50 that are referral or people who find me on the web. So the more things that get put out there, more people will find me on the web, and then they'll go, oh my gosh, I'm glad I found you. I mean, I had a couple this past week that came to me. They had gone gone to a seminar locally and just didn't seem to be getting good feedback from whoever ran that local seminar. They had people calling them on the phone, oh, we can do Zoom, do a split screen, which I can do, but some people don't want to do it that way. We understand. They really wanted to be able to sit down face to face. So they came to my office, and I believe from Crossville or Gainesboro. I can't remember which it was now. I've had so many people in this week, I can't remember where they all live. But, it wasn't a big drive, but they were willing to come in and sit down, wanted to, that feedback with somebody they could sit down with. So that's one of the big things that I offer. That, hey, I'm a local guy. I know what's going on with the local networks. Like currently right now, the Vanderbilt is not accepting the Blue Cross Advantage plan. They're not accepting the Humana HMO Advantage plan. They are the PPO. And then in East Tennessee, I think I mentioned it recently, Summit Medical Group, which is a huge doctor network in the Knoxville area, are in dispute contract negotiations right now with Blue Cross, and if they don't come to an agreement January 1st, they're not going to be accepting Blue Cross. And at first when I read that, and I've mentioned this recently too, is I thought it was just the Medicare Advantage, but the info I got is Blue Cross across the board. That's a big deal. So not so much, again, that's not a big concern here in Middle Tennessee and the Upper Cumberland. But East Tennessee, that could be an issue because a lot of people use that Summit Medical Group. And again, that goes back to that having that local agent that knows the area. When I lived in East Tennessee, I've worked with a lot of people that went to Summit Medical, so I'm very familiar with that. They had several offices. When I was in Roane County, they had two offices there that the local doctor's office in that small county. So that kind of gives you an idea how big they are. They had a clinic. They had a clinic in Rockwood, one in Kingston, one in Oak Ridge, and then all around the Knoxville area. So they're huge there. And so that's somewhat what you get. And then what's going on with some of the doctors' practices here. That's what you get with the local agent. I know, I'm sorry, I keep harping on that. But I just wanted to touch on that and then get into some of the other things that have been concerning me. I've been getting a lot of the questions about the one big beautiful bill, which really isn't affecting Medicare that I can see. There's going to be some Medicaid changes, but again, that's not supposed to affect anyone that's over 64. But some of the younger people are going to have to recertify. But again, it's those with legitimate, extreme disabilities that have different waivers, the people are worried about losing their TRICARE. It's going to be more of the, hey, you almost didn't qualify for TRICARE. You have to keep reevaluating, your income. Used to be, every year you had to update to make and show whether you're earning more or whether you're still entitled, or the kids have had a birthday, and so that they're not covered by age, and the parent loses their coverage too. Those things are going to happen, and you may have to recertify a little sooner to keep those benefits in place. It's to cut down on the waste, not just to take people off of benefits. So, as I say, if you have very legitimate, there are disabilities that get approved, but you have to keep recertifying that disability is still an issue with you not being able to work, or you're caring for a loved one with those disabilities. So that's something you have to redress in that starting. And actually, I don't think that's even going to start until 27, or maybe it may be in 26. But that recertifying every 6 months. So that's not right now. And again, like I said, that doesn't really affect the Medicare folks. So, and I've talked about in the past the Medicare supplements, that a lot of people are getting the notices for their rate increases. There have been some really substantial rate increases on a lot of plans. And what I've talked about in previous shows is that Plan N generally is not having as high a percentage increase as the Plan G. And, of course, Plan N is a lower premium to start with. So if you've got one plan that's going up 18% and then you've got another one that's going up 12%, and the one that was 12% increase was already a lower premium, you're going to have a much lower increase on your plan. It's going to stay more affordable. The other thing is, like I said, if you've gotten a rate increased notice from your Medicare supplement provider for your Plan F, your Plan G, even your Plan N. You can shop that. As long as you won't be turned down for health conditions, you can change your Medicare supplement and get a lower rate. And I bring that up because I'm not at my busy season yet, and you do not have to wait until the annual election period to change your Medicare supplement. I know I've harped on that here a few times. There's no annual re-enrollment for Medicare supplements, so you can change them at any time. And like I said, if you got a notice that, hey, your plan's going up $30 next month, well, let's check and see if I can't save you money on another plan, because a lot of times you can save that income or that premium, and not just the fact not have that higher increase, but find a plan that's actually lower than what you're paying right now, because depending on how many years you've had those rate increases. The other is, hey, you may have a Plan F. One of the ways to definitely save on a Plan F is lower it to a Plan G. Even when people who were eligible, that were new to Medicare, were eligible to get Plan F, because those new to Medicare can't get it now. You had to be eligible prior to 2020. Even then, I encourage people at that time to get a Plan G, because again, you're starting at a lower premium. Plus, if you take the deductible for Part B, which currently right now is $267. When you add that, or you subtract that $267 from your total annual premiums for your Plan F, and then calculate the total annual premiums for Plan G was still less, even with having to pay the deductible. So a lot of folks went ahead and got Plan G and kept it more affordable, and even more so now with Plan N. So you may want to switch from an F to a G. You might want to switch from a G to an N to lower those premiums. The other one is, and I've touched on it in a previous show, is the high deductible G. Now, the high deductible G, you do have some out-of-pocket costs. They call it a deductible. It's truly actually a maximum out-of-pocket. And I know I misspoke the last time. I think it's like $2,780, and that may not be exact, but that's pretty close. So you've got, if you just want to round off, you've got about $3,000 out-of-pocket costs that you're going to have in addition to your monthly premium. But you may be paying $40 to $70 a month for that high deductible G instead of $120, or like I said, if you've been on the plan for a while, you could be over $250 for a Plan F or a Plan G. So if you go to the high deductible plan, you save a lot of that. Now, what happens with the high deductible plan is, with like the high deductible Plan G, you still have that $257 Part B deductible. Once you've hit that deductible, Medicare is paying that 80%. So the only thing going to that $3,000 out of pocket is that 20% you have left over. And if, God forbid, you are admitted in the hospital, you will have that almost $1,700 Part A deductible, but that goes to, and again, that goes to that $3,000 max out of pocket. So you can save about, some plans, you can save $80 to $100 a month on your monthly premium, and you're risking having about $3,000 out of pocket. Anyway, you have plans that can help you cushion against that. So anyway, I'm up on the break here, and we'll be right back.
It's back to school time, and Twin Lakes Fiber Internet gets an A+ for keeping everyone happy online. Kids doing homework, mom watching her favorite show, dad glued to the game. Rest easy knowing your internet can handle it all with a gig speed fiber connection. Now with new speeds and lower prices, there's never been a better time to make the switch. Call 800-644-8582 or visit twinlakes.net to get started today.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and welcome back from the break. I was talking a little bit just before the break there about the high deductible G, and I mentioned, is you might have about $3,000 out of pocket, and we can help cover that with a hospital indemnity plan or a cancer plan or cancer plan that will cover you against those major expenses. And even then, generally, you can add, depending on your age, because the They don't go up as you get older, but the initial cost is a little higher if you start at an older age. If you're getting the plan at 67 instead of at 64 or 65, yes, it's going to cost a little bit more, but you'll lock in that rate there. So anyway, that's why I wanted to talk about that, was because even if you get a high deductible G and supplement it with those plans, it'll help cover those out-of-pocket expenses. You've locked that. That's still going to be less than you're probably paying for a Plan F or a Plan G, maybe even a Plan N right now. And the cancer plan and the hospital indemnity plan, you lock in that rate until as long as you continue to pay it, that rate's not going to go up. Now, your Medicare supplement will still have increases, but on the high deductible G, it's going to be a lot less. It's going to be it's going to be a lower percentage because you're spending more money on your health care before the insurance company has to pay it. And you start at a lower amount, so 7% increase instead of an 18% increase on a half as much premium, you're not seeing much of a raise at all. So that's a way to keep your health care costs down. And again, if you're already on a Medicare supplement, let's sit down and go over those numbers and see if that might work for you. So anyway, there's a new plan out there. It's not a new company, but they hadn't offered this kind of plan before, the hospital indemnity plan. I'm not going to say the company name now. Now, I think they're giving me some literature that I can maybe publish that on my Facebook or even on my website, but I'm not going to say the company name here because it's always iffy that you get in trouble say the wrong thing and they go, you can't represent us anymore because you said this on your radio show. But one of the things that's different about this plan, I had never even thought about it before, they actually have a pet boarding benefit. So I've talked about hospital indemnity plans that you can get a lump sum just if you're admitted in the hospital, or you can get so much per day that will cover, reimburse you for those like $300 to $400 per day hospital copays on your Medicare Advantage plan. This one here will actually pay $75 per day up to 14 days in a calendar year if you have to board your pets while you're in the hospital. And that's actually built into the basic plan. It's not a rider to add on. So it doesn't matter whether you have a pet or not, or if you get a pet and now you're in the hospital or you're going to be in the hospital because you have upcoming surgery, you can schedule to put your pet in that boarding facility and know they're taken care of. And now they do have to be a licensed pet boarding location. It can't be, I'm going to pay my neighbor to watch my dog and they're going to pay me $75 and I'm going to pay my neighbor $25. And you're not going to be able to do that. But all you have to do is get the receipt from the pet boarding place and submit that for your claim if you're hospitalized. So I just thought that was really neat. But this plan here, it's issue ages 18 to 85, and you also get a 7% household discount if you have someone else living in the household. And one of the things that comes up with the hospital indemnity plans, because we usually kind of fit them to go alongside a Medicare Advantage plan, and as I mentioned a little earlier, also with a high deductible G, is a lot of plans 64.5 to 65.5, some of them to age 70, will be guaranteed issue. So what that means, you can't be turned down for having health conditions. Now, there's some limitations on whether it will pay out right away. There's some waiting periods, but say you're diabetic, some of the plans are just go, you're diabetic, we're not going to issue the plan. Or you had a heart attack a year ago, sorry, you can't get the plan. But you're in that guaranteed issue window, you're fine. And as long as it's 6 months or 12 months later that you have something related. And that's the other thing. Maybe, you have, what's the other one? COPD. You have COPD, so that may turn you down for getting a plan that's not guaranteed issue, but you could get this plan. And if you did have a heart attack and were, of course, hospitalized, it's going to pay for the heart attack because a heart attack and COPD are not it's not the same condition. So just because you have COPD and then have a heart attack, your heart attack is not considered a pre-existing condition for that. And I'm just using that for example, and don't hold me to everything on that. But I just kind of wanted to get that illustration of how the pre-existing condition works. And like I said, and this one here is guaranteed issue from age 64 to 74. It has a built-in cancer rider, so you can just add, $10,000, $15,000 of cancer coverage. And I recommend cancer plans to all my Medicare clients, whether they have a Medicare supplement or a Medicare Advantage, especially on a Medicare Advantage, because you're going to have some big expenses and maybe hit that max out of pocket on that plan. But even if you have a Medicare supplement, you got a Plan G or Plan F, you're not going to have any medical costs for your routine cancer care, but there's some things that Medicare won't cover. Maybe something's still considered experimental. So your Medicare's not going to cover it. Medicare doesn't cover it. Your Medicare supplement doesn't either. The other thing is a lot of people like to travel to get better care. And I say travel, not not going on vacation, but they're going up to Minnesota to go to Mayo, or they're going to Houston to go to MD Anderson. They're going to go to some place that they've heard is going to give them the best cancer treatments. I know some people, there's places where they go in Mexico because it costs a lot less if you're paying for it than going somewhere in the United States. You're going to have travel expenses. And that's where a cancer plan can come in really handy, because you cover those expenses that aren't covered. I mentioned the pet boarding things that happen, or you're going to be sick. Maybe you're live alone now, and you're like me, still mowing your own yard. I still like to get out and get out. Of course, I use my riding mower, but I like to get out on my riding mower and do my mowing. That's kind of my me time, as they say. So you may be used to doing that, but now you're having cancer treatments and you can't keep up with it. You need to be able to pay somebody else to do it. So there's some money. There's other expenses that come into play when you have a debilitating illness that aren't covered by your health insurance, and that's why a cancer plan can be very handy. So those are some things you can add on. The benefits start as soon as the coverage is issued. Like I said, other than as pre-existing condition waivers, but as long as it wasn't as a result of a pre-existing condition, you can qualify and get the benefits. One of the other things I want to talk about, I probably don't talk about that much on my show here, but I do also offer annuities. And one of the companies I work with gave me a nice flyer here. And one of the things kind of unique about their plan, they may not have the highest rates on their MIGAs, as we call them, the multi-year guaranteed annuities, but their interest is compounded. So one of the examples they had here was somebody got one of the plans at a $75,000 policy, and on this one plan on a 5-year rate, their simple interest was 6.1%, and on this plan, their compound interest is 5.45%. And so the total return on this in 5 years, the one plan was $22,875, but on the compound one was $22,789. So there was very close to being that same return. So it can multiply, and then if it's a 7-year plan, it even went almost $1,000 more on that return. So it depends on how many years you're getting it for, but you can get more interest earned with that being compounded. And I've especially talked about this. I want to reach out as we talk about if you have lazy money, you got money sitting in the bank, or maybe it's not even sitting in the bank. Maybe you're just keeping it, as they say, in the mattress. If you've got at least $5,000, you can get a MIGA annuity, whether it's a 3-year, 5-year, 7 or 10-year, and you're going to earn more interest than you would if you have it in the bank, even in a CD. So and it's not totally locked up. You can take withdrawals. You can close it out at any time. Of course, it's the same thing like with a CD. You may have some interest penalties if you cash it out before it matures, but you can withdraw the interest every year, and there's no charge for that. And generally, about 15% withdrawal each year without any penalty. Now, of course, your account isn't going to grow as well because you're taking the money out. But it's not as liquid as having just money in the bank. But if you got money just sitting in the bank drawing no interest or less than 1%, it's crazy. That's what I noticed on my checking account. It's like I think I still get I get like 0.1%. So every once in a while, I'll have a penny added to my account. So that's one of the things with annuities. And again, that's something we can do anytime. You don't, and preferably, again, like I said, with like changing your Medicare supplement because you want to get a lower rate. I've got time right now. I'm getting busy. I mean, we're getting into our Medicare prep season, so I've got meetings that I'm going to be going to. I got to run to Nashville, of course, because they're not going to come to Cookeville and go over everything that's coming up with us. They want us to come to Nashville, so I've got some things scheduled. Got to go to Top Golf on one of them, and I think another one's going to be at the Dave & Buster's. And they give you materials. We get some of the swag, the pins and the magnets and those things that I can give away, and use those for giveaways to clients or the senior center bingo. Oh, and one thing I wanted to mention before I forget, we're almost out of time. I've partnered with 94.7 The Country Giant. We got a cruise contest going. All you need to do to enter, and obviously you probably go to the website and figure out who all's doing it because I'm not the only one. You come to the office, I've got a little poster, and you scan the QR code on the poster, and then that brings up the entry form. And you can go that at each sponsor, and that's how many times you can enter. So you can go to each sponsor and enter that contest. And, of course, hey, you probably want to go with your spouse. And, hey, if you're married, you probably both want to enter. But just come on by the office and enter. And also, we're giving away a $50 restaurant gift card so there's a ticket to fill out for that when you're at the office. So you get to enter 2 contests when you come by the office. No purchase necessary, of course, but we hope to be able to give that prize out. And, of course, as always, you can go to insurancematchmaking.com to suggest a guest for my show or a question that you would like me to answer on here. And as always, remember, at Matt Libby Insurance, we can cover you from head to toe, and it doesn't have to cost you an arm and a leg. So until then, we'll talk next week, and have a great August. It's August now, believe it or not, and that's, like I said, we're in the busy time to get ready for Medicare. Talk to you soon.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.